Well, tell me about the book that you recently wrote, the Concussion Rescue. What made you want to write a whole book on talking about traumatic brain injuries and recovery from them?
Yeah. So when I started working at AmenClinics 8 years ago, where we do brain imaging, I would start to see patients who had had obvious brain injuries as part of their psychiatric history, but they didn't know about it. So there's one case, we'll call him Jeremy. And when he came to see me when he was 21 years old, jazz drummer in locally, and really talented, but he's terribly depressed. He had been depressed since he was 14 years old. And the only thing that helped him, smoking pot, he'd drink. He was in a kind of toxic relationship with his girlfriend. His band wasn't going anywhere. Life sucked. And he had tried, for no lack of trying, he had tried every class of medications. He had seen some excellent therapists, was referred by a great therapist. He had done EMDR, CBT, all these different kinds of therapy. He hadn't done neurofeedback, I don't think, though. But he came to me, and we saw when we imaged him that he clearly had damage to the left frontal lobe and the left temporal lobe. And I said, Jeremy, when did you have a brain injury? He said, I had never had a brain injury. What are you talking about? In his intake, there was nothing listed. His mom was with him, and typically brain injuries are very minimized. We don't think about them. Like I said, okay, so at AmenClinics, we try and ask 10 times if you have ever hit your head, have you ever had a brain injury? Because people forget. Have you ever fallen out of a tree, fallen off a log, had a car accident, dove into a shallow pool? Yeah, it's helpful to ask specifically or to think back if you've ever had any of these things happen, because we tend to brush it off because you don't see the damage in the brain. Have you ever played contact sports? Oh, his mom said, yeah, you did started playing football when you're like 13, 14 years old. You're still this scrawny little kid mashed up against the coach's son. He would get pummeled and have headaches and nausea after practices, just thought he had worked out too hard. But he had had these many concussions and subconcussive injuries to his brain repeatedly. And he had been diagnosed with ADD at the time, started having the depression, which progressed to suicidal thoughts every single day. So we started treating him. We gave him not only a change in his medication regimen to stabilize his temporal lobes, but we also gave him nutrients to help him heal his brain, got to stop smoking pot, and sleep normal hours, stop staying up so late at night. And over the next several months, his depression lifted, his suicidal thoughts went away, broke up with the girlfriend, felt confident. And now he just graduated from the Berklee School of Music. This has been several years later, doing great, no problems. So to me, that opened my eyes that, okay, there's all of these people who have brain problems, whether it's depression, anxiety, focusing, anger, who may have had brain injuries. And when we see them, we know that they've had brain injuries. And so I got very excited about this. And the AmenClinics has known this for years. We've been here for 30 years. We have 180,000 scans in our database. And these are functional scans. We're looking at blood flow. We're looking at activity of the brain, which is different than an MRI or a X-ray, which is more looking at the structure. We're looking at function. How does the brain function? And we can pick up injury. So then to the book, my thought is, let's put all of the pieces together. People who can't come to AmenClinics or maybe want to get a head start on their healing, let's put it all together. It's not one thing that heals the brain, it's multiple pieces. And this is something that I put together over the past 8 years working at AmenClinics. It's like, okay, these supplements help, these kinds of dietary intervention help. You got to make sure the structural support is there and that there's not impingement on cerebrospinal fluid flow and blood flow in the upper cervical spine. Did a podcast last week on upper cervical chiropractic work and the specific techniques to help there. I always like to rule that out. Hyperbaric oxygen, when to put that in. The labs that we talked about earlier, optimizing those values. So if you put all of those together, that gives someone the best chance for healing, whether it's been just a few weeks since their injury or it's been years. It's never too late to actually try and help heal and improve brain function.